Hi, welcome to My News 2. I'm Tara Lynn. Here's a look at today's topics. When you experience back pain that shoots down your leg, everyday activities become difficult or even intolerable. One cause of back pain is a herniated disc, and sometimes called a slip disc or a ruptured disc. We're going to talk to a doctor about a new procedure to end that pain and keep it from coming back. And we all fell in love with him and his designs on the Project Runway catwalk, and now fashion designer Michael Knight is here to unveil his full fall and winter collection at the Charleston Fashion Week. We're going to talk to him about his inspiration and his collection. And who doesn't love cupcakes? We're going to tell you how you can enter to win our Decorate Your Inner Cupcake contest and even give you a head start with some decorating ideas and tips from the professionals. Well, for patients undergoing surgery on a herniated disc, there is a 15% chance of recurrence with conventional surgery. And now, though, there is a new procedure to help prevent that recurrent disc herniation. So joining us now, we have Neurosurgeon Dr. Jason Highsmith with Trident Health Systems. Thank you so much for being with us.
Thank you, Tara, for having me.
Now, I know I've heard a lot of people, my grandfather went through a herniated disc. This is a very painful situation, a medical condition to have to deal with, right?
It is, absolutely, especially when you get a pinched nerve that results from it. It causes what we call sciatica, which is a piece of the disc fragment actually pinches a nerve, and that causes a leg pain called sciatica. Now,
I know there is now a new procedure that you have just recently performed to sort of help with the issue of having the surgery, having the problem fixed, and then having it come back again. What was that traditional surgery like, and how does that compare to the new procedure that's available?
Correct. Let me go ahead and show you on the model here. A disc herniation is essentially a piece of disc fragment that ruptures out and pinches the nerve. The conventional treatment is to go and actually remove that fragment of disc and take it off the nerve, what we call a decompressive microdiscectomy. That works very well, but it does nothing to repair the actual disc itself. The disc still has a hole in it, still has a weak spot that we rely on time to heal. We actually wait several weeks to months before we let patients resume activity. And the problem is that some patients will recur. About 15% of patients will have a disc that recurs and reherniates, which could need additional surgery and can also lead to fusion and other more dramatic surgeries.
So you said before in the traditional surgery you've removed that, so how does this new procedure compare? What's different about this that makes it, because it's also a quicker recovery time as well?
It's much quicker recovery time. Instead of just taking out the fragment of disc, we're actually able to patch the hole in the disc through what's called an annular repair. And an annular repair is simply a sewing of the annulus, where we go in and we actually bring the two edges of the hole together and close the hole that caused the herniation in the first place. By doing this, we hopefully will prevent further recurrences and reduce the risk of repeat back surgery being required.
And I know we're seeing sort of a demonstration here. At this point right here, which part is that?
This is this conventional discectomy right here, where we take out the fragment of disc that's pinching the nerve, and this is what's done currently. But you see that that hole in the disc is still left. The hole that's left can re-rupture with time just because it's still a weak spot in the disc. We usually let that scar in and heal with time, but sometimes it never heals 100%. This new technique lets us actually go in and manually close that rather than letting it heal on its own. We can actually accelerate the healing of that disc and, again, hopefully prevent additional.
And with this new procedure, is this open for, is everyone a good candidate who has a herniated disc, or is there someone who may not necessarily need this new type of procedure? It may not be best for them.
Sure. Best patients are patients that have a fresh disc herniation, a ruptured disc that's very acute, meaning it's happened within the last few weeks to months. We do let most patients with this condition heal on their own before we consider surgery. We try physical therapy, we try epidural injections. But when patients do make it to the operating room, we're able to offer this surgery for about 10 more minutes of operating time and hopefully reduce that risk.
And how's the recovery process? Because this is shorter. How does that compare? How much shorter than the traditional surgery?
I let patients after the surgery go back to normal activities in about 2 weeks, and we used to wait about 6 weeks.
2 weeks, like going back to the gym, being able to run?
Correct.
I think that's pretty phenomenal, isn't it?
It's definitely much better than 6 weeks of restricted activity.
I feel like we are just making so many more medical advances, and that recovery time is getting a lot shorter and the incisions are getting a lot smaller. Where do we go next from here? I mean, what is the next step to even further this?
There's several things we're looking at our practice. One of them is a facet replacement, where we actually replace the joints in the back of the spine. Instead of actually fusing those joints, we're looking at artificial facets as a solution to chronic stenosis and other back pain problems. One of the other studies we're looking at that I'm actually enrolling patients for right now is a study looking at spinal cord stimulation, which is an electric nerve stimulator to block pain rather than repeat back surgery. So if someone's had back surgery, they're still having a lot of leg pain and back pain, and someone says, oh, you need another surgery, maybe they don't. We're able to hopefully offer a stimulator that actually blocks the perception of pain and blocks the fibers transmitting that pain into the brain.
And of course, hopefully less surgeries means less medical bills as well.
Correct, and more quicker recovery.
Absolutely. Well, Dr. Highsmith, thank you so much for sharing your expertise. And I stayed away from sciences in college. It's a good thing I did because I know nothing about all of this, but thank you for sharing your expertise. It was great information.
Thank you.
All right, Charleston Fashion Week in full force, and under the tents and